Hi guys, I'm Dr. Behnam. I'm a board-certified dermatologist in Los Angeles, California, and I specialize in stem cell hair restoration.
And I'm Dr. Behnam. I'm a hair restoration and hair transplant specialist. I do all the hair transplant surgeries in our office.
And we are twins, and we both focus in hair, just different parts of hair. So today, welcome to another stem cell hair restoration video, and we're both going to be on it. So today, I'm actually going to demonstrate one of our patients for before and after photo, someone who had stem cell done. So this is a patient who came in, and he was thinning quite a bit right in this middle part. He's a young gentleman, and it was bothering him quite a bit. And he came in, and what we decided to do was stem cell with PRP. So the PRP we use is 60 ml PRP. We draw the blood and we spin it. We do a double spin PRP, and then we add 30 million stem cells to the PRP. We clean the area, and then we have him do laughing gas, so it's a little bit high, and then we numb the area, and then we basically inject the stem cell. Remember, the technique of injections, the depth, the spacing, all really makes a difference on the type of results you're gonna get, and obviously derma rolling afterwards makes a huge difference. The reason why he's a good candidate is because, as you could tell, you could still see a lot of hairs, but you could see the scalp, but he's not balding. So this is him done in December 22 of 2022, and now this is him. He came back and saw us on April 21st, 2023, and this is really me trying to part some of the hairs apart, but you know, that area really grew out. So this is a before and after of a stem cell with PRP 4 months later.
And from a surgical standpoint, people can ask, well, why can't this gentleman do a hair transplant surgery? Well, you don't have enough hair loss to actually do a procedure. So if you go through it 1 year later, you're not going to see a significant improvement more than this, because you're really replacing one hair with another hair. You're going to get a lot of shock loss. So the best option is really medical treatment, and stem cell is one of them, and that's actually quite impressive.
Yeah, so, and remember, stem cells, you know, there are many different types of stem cells, different quality ones. We always use the best quality to achieve the best results. Stem cells by definition are not FDA approved, but we do use we do follow all FDA protocols, and we do inject them IV, and yeah, so he was very happy. Stem cells are mainly for the temporary improvement of hair growth, so the results typically last about a year to a year and a half. So he's gonna come see me maybe later on in 2023, and we're gonna see how he's gonna do. Thank you so much.